Have you ever caught a glimpse of yourself in a store window and wondered, who is that person? As we age, we develop subtle habits that others clearly notice, but are too polite to mention. These habits can make us appear older, less vibrant, and even push people away without us realizing it. I'm Dr. Elliot Graves. After 30 years in geriatric medicine, I've helped thousands of seniors navigate the journey of aging with dignity and grace. What I've observed is that small, unconscious habits can have a profound impact on how we're perceived and, more importantly, how we feel about ourselves. In today's video, I'll share 6 habits I've seen in my practice that can age you faster socially and emotionally. The good news is that once you recognize these patterns, they're remarkably easy to change. These simple adjustments can help you maintain meaningful connections, feel more confident, and quite honestly, enjoy life more fully at any age. 1. Neglecting personal care. One of the first signs I notice in my practice but rarely mention directly is when someone begins to overlook personal care details. Take Martin, a 78-year-old former high school principal. He'd always been meticulous about his appearance, but after his wife passed, small details began to slip. Untrimmed nails, unkempt facial hair, slightly stained clothing. His family noticed, his neighbors noticed, but no one said a word. It wasn't until his 8-year-old granddaughter innocently asked, "Grandpa, why are your eyebrows so bushy now?" that Martin really looked in the mirror. That evening, he trimmed his eyebrows, shaved properly, and put on a clean pressed shirt. The next day, 3 different people commented on how well he looked. From a medical perspective, neglecting personal care isn't just about appearance. It often correlates with depression, cognitive changes, or physical limitations. But the simple act of maintaining these routines signals to your brain that you matter, that each day has purpose. Small tip: place a magnifying mirror in good lighting and do a quick personal inventory once a week. Check eyebrows, ears, nose, nails, the details others see but won't mention. 2. Volume and conversation patterns. With age, many begin to speak louder or interrupt more frequently without realizing it. Helen, 73, a retired librarian, was puzzled when her book club meetings grew shorter and friends seemed less engaged. Her daughter finally recorded a family dinner on her phone, and Helen was shocked to hear herself dominating conversations and speaking at volumes that made others lean away. What was happening? Helen had mild hearing loss that altered her perception of her own volume. Additionally, a common cognitive change with aging is reduced inhibition, making us more likely to speak without waiting for natural pauses. Helen got her hearing checked, became conscious of her volume, and practiced waiting 3 seconds before responding in conversations. Within weeks, her social interactions became richer and more reciprocal. Medical insight: our brains are remarkably plastic, even in our 70s and 80s. Simple awareness exercises can create new neural pathways that help us monitor our conversation patterns more effectively. 3. Wardrobe that ages you. Many of my patients inadvertently age themselves through what they wear, not because but because they've stopped adapting. Richard, 81, wore the same style of baggy chinos and oversized button-downs he'd worn for decades. When his grandson got married, his daughter gently suggested some new clothes. Richard reluctantly purchased properly fitted trousers and a tailored shirt. At the wedding, several old friends commented on how vibrant and healthy he looked, though nothing had changed except his clothing. The science behind this is fascinating. When we wear clothes that droop or sag, our posture often follows suit. Additionally, clothing that belonged to a different era can subtly signal to others that we're not engaged with the present. Simple adjustment: you don't need trendy styles, but focus on 3 things: proper fit, clean lines, and good condition. Even comfortable classics look distinguished when they fit well and aren't worn out. 4. Perhaps the most powerful habit I've observed is the tendency for some older adults to fall into patterns of complaint, criticism, or pessimism. Frances, 76, was beloved for her sharp wit, but after retirement, she found herself increasingly critical of waiters, weather, politics, even her grandchildren's choices. She didn't realize how pervasive this had become until her 4-year-old granddaughter asked, "Grandma, is there anything you like anymore?" This struck Frances deeply. She began a simple practice. Before speaking, she'd ask herself, "Is this adding light or darkness to this moment?" Within months, her relationships transformed. From a neurological perspective, negativity creates a self-reinforcing cycle. Our brains have a natural negativity bias that strengthens with use. The more we complain, the more our neural pathways become primed to notice problems. The good news? Positivity works the same way. Research shows that consciously practicing gratitude and curiosity physically reshapes brain circuits, even into our 90s. Simple practice. Try replacing criticism with curiosity. Instead of, "Young people today don't know anything," try, "Things were certainly different in my day. I'm curious how you learned to do that." 5. Physical presence and posture. How we carry ourselves communicates volumes before we speak a single word. Margaret, 85, was remarkably healthy but had begun slouching, shuffling slightly, and looking downward when walking. Despite her sharp mind and physical capability, people began treating her as fragile and diminished, offering unsolicited help and speaking to her in simplified language. When we discussed this pattern, Margaret began practicing what I call mindful movement, walking with her chin parallel to the ground, shoulders relaxed but not rounded, and taking deliberate steps. Within weeks, she noticed strangers engaging with her differently, making eye contact, speaking normally, treating her as a capable equal. The physiology here is remarkable. Posture directly affects respiratory function, which influences energy levels and cognitive clarity. Additionally, how we move affects the brain's production of confidence-related neurotransmitters. Daily practice. Stand tall, imagining a string pulling upward from the crown of your head. Walk with purpose, even for short distances in your home. The body and mind reinforce each other powerfully. 6. Sensory awareness. Our final habit relates to something many find uncomfortable to discuss: sensory changes that affect our social interactions. With age, our sense of smell often diminishes substantially by up to 75% by age 80. This means many older adults are unaware of breath or body odor issues that are immediately apparent to others. Walter, 74, a widower and former engineer, was puzzled when his grandchildren's hugs became brief and people seemed to maintain unusual distance during conversations. His daughter finally mustered the courage to mention that his breath had developed a strong odor. Walter was mortified but grateful. A dental check revealed early gum disease, and he discovered his medication caused dry mouth, both contributing to the issue. Simple interventions like staying hydrated, using free mouth rinse, and scheduling regular dental checks transformed his social interactions. From a medical standpoint, sensory decline is normal with aging, but its social impact can be profound. Many of my patients who felt invisible or excluded found that addressing these sensory blind spots dramatically improved their social connections. Practical tip: ask a trusted person for honest feedback. Schedule regular dental checks. And remember that staying well hydrated helps with both breath and natural body odor. We've covered 6 habits that can age us faster socially and emotionally: personal care details, conversation patterns and volume, adaptive wardrobe choices, cultivating positivity, mindful posture, and movement, sensory awareness. What makes these habits so powerful is that they work together. Small improvements in each area create a compounding effect that can transform how others perceive you, and more importantly, how you feel about yourself. Remember, the goal isn't perfection or to deny the natural process of aging. It's about removing unnecessary barriers to meaningful connection and self-confidence in your golden years. Which of these habits resonates most with you? Let me know in the comments which one you might focus on this week. And if you found this helpful, consider subscribing for more insights from my 3 decades working with remarkable seniors just like you. In my next video, I'll be sharing 3 simple morning practices I've seen literally transform cognitive function in my older patients, including one 92-year-old who reversed early memory decline with a 5-minute daily routine. You won't want to miss it. Until next time, this is Dr. Elliot Graves, wishing you health, connection, and joy at every age.